Hello, welcome to another video, and this one's quite a quick one where I'm going to look at some unique shoulder exercises. Oh, not all of them are shoulder, but some basically just trying to use what's called reactive neuromuscular training. So in a short, basically what that means is using some resistance of tubing, like resistance band or rubber tubing, to encourage the body to continue moving in its poor movement strategy, and to basically force you to react to it to do the correction. All right, so this first one exercise is very, very simple. This is an introduction to something like that. I'm not even using resistance. All I'm doing is standing in a good posture and just leaning forward into an even worse posture. So that person who's already in that forward posture, if you've basically forced them into that, it forces the correction, and vice versa. If they're hyperextending, then it forces the reaction to correct it. All right, so I could do this. These are exercises that are all designed to do by yourself, all right? But if I was working with the person, I'd be basically trying to push them forward. So I'd be behind them, pushing them forward, so that their reaction would be to correct it and bring it back, which is exactly what I want them to do. So that person is always in an excessive forward lean. I'm actually trying to make them do it wrong, to force them to use the muscles that would activate it to correct it. And same in this hyperextension. All right. So quite a clever way to get the muscles to do what you want them to do, especially weak and lazy or inhibited muscles that just really don't fire either at all or they're too late in their reactions. Now this is an exercise we've used many times before. Again, this is to show you like how you would do like a reactive exercise by yourself, because obviously the best reactive exercise is a partner pushing you or prodding you. So in the case of this one, if I was on the floor and say I'm out into the extension part, which would be right here, where I'm unstable there, all right? If I was a partner, I could be pushing them. If I see that they're leaning this way, I would basically be trying to push them even further that way, so that they respond and push back into the correction to level themselves off. So it's an example of where I'm just basically feeding the mistake to apply the correction. And you'll see there's a common theme amongst all of these. So if from a front-on position, you might see a little bit more deviations. Although I think I might have done this one all right, but this will give you a better idea of where. See, I a little bit lose it here. See that? So in this case, if I would continue doing that, and I was a person helping him or helping me, I'd be pushing myself even further that way, so that my body would react, especially around the core and the hips, to pull up and flatten myself off. All right. So it's again, very, very simple exercise, but very, very effective. And this has an element of not just core stability, but shoulder stability. So if this shoulder's not stable and I'm trying to get away from putting pressure on there, that's when also I might be on this angle instead of being nice and flat. All right. So there's a couple of real simple ones that are examples of this reactive neuromuscular training technique. When we move into, I'm going to move into a second into more advanced shoulder ones. These give you, because shoulders are very difficult to work because there's just so many muscles that contribute to problems, and there's so much compensation and dysfunction that applies with all of that. So this first exercise is a dumbbell row, which is a very simple pulling exercise known for developing strength in the in the middle, upper traps, rhomboids area. And what I've done here, which you can't really see because the band is very clear, but there's a band that I've wrapped around my hand here. All right, and I've attached it to this bench, and it's basically like I'm quite a fair way away, so there's quite a fair big bit of a pull that's trying to pull my hand in that direction. So it's actually trying to create, which would create a pinching feeling in here, and wouldn't actually activate some of my lats to keep it well aligned. So again, you can see how this is feeding, the tubing is feeding the mistake, which is what we see sometimes with this movement. All right. So then all I do is, while I've got that band around my wrist as such, I just go into this dumbbell row exercise, trying to maintain that. It's quite a simple exercise at the best of times. I just have this additional work to do that encourages the weaker and lazier muscles to be contributing into the movement. All right, so it's quite a clever way to get what you exactly want, and overcomes compensation quite quickly, and even pain on some of the other ones that we'll see towards the end. All right, so that's the first one there, and I'll just move forward to this next one. So if I go from a dumbbell row to a shoulder press, all right, now I'm going to use that same band that I had before, and this time I'm going to wrap it around my wrist again, but now I'm got a small dumbbell and I'm going to work overhead, and the cable this time is pulling me backward, not forward. And then just move into this shoulder press position, and it's ironic. People might have pain with this without the band. You add the band and they feel like they've got the freedom, because it actually is like a rotator cuff exercise that most people are aware of when you're doing external rotation, where you're sort of moving that up and down, but it's an isometric hold. So it actually helps to center the humerus in there, but within this shoulder press movement. Now, the only thing you may need to do is keep your core engaged, because some people might try to hyperextend their back in these sort of standing upright movements. So that's where you want to keep quite a light weight. Obviously, if you're working with shoulder injury, you wouldn't want to go heavy anyway, or trying to correct a dysfunction. Right? But this is quite a clever way to get what you're looking for within the overhead shoulder movement, which for shoulder pain is usually probably the hardest thing to get right. So this will be sort of towards the end of a rehabilitation program, but just to give an example of again how you're feeding forward. You're feeding your mistake with the technique to make you produce the correction that overcomes it. All right, so then the next one, we're going to use a small band. I'm going to go back to a rowing movement again. Now, with shoulder, especially rowing exercise with two arms, you see it sometimes with one arm as well, but you'll often see the elbows come in way too close to the body. So what I've got this time is I've got the band wrapped around my elbows, and once again it's actually trying to make me keep the elbows in, where I'm going to have to force them apart. So you can see here that band is really pulling in tightly, really trying to close it in this way, so pulling me there and pulling me here at the same time, which means that what happens is my scapula gets jammed in the back there. So I need to have a gap when I pull it. So right here there should be, and I've got a good gap. See how that band had to really pull apart, because I can sense that it's going to jam me in. So I get this nice little gap between my rib cage and my elbow, which is exactly what I should have for a good scapular placement on a pulling movement. All right, so I could do this with a seated cable row, or in this case the standing cable row, and it's quite a clever way to get what you're looking for, all right, within this integrated movement. All right, so you're getting good scapular timing by forcing the mistake and making them overcome it. All right, so that's going from a sort of a single one we did before to the double arm movement as such. All right, so then moving on to the next one, and we'll see another example this time of with the same small band, but more of a pushing stability exercise. And you'll need not as strong a band on this one, because this is a much more difficult side. I'm just changing the band here to a lighter resistance. So this is where I'm like in a push-up position against the wall, and what the band is trying to force me to do is pull apart again. All right, so it's pulling out like this, and the purpose of that is to try and get this scapula to sit out here, because normally it's got to get bunched in, and I'm going to get too much retraction, and my scapula sitting too low. All right, so then I get this pinching into my neck and my shoulder. All right, so this is a clever way where I can introduce single arm stability, and when I move that left hand, then, or in this case where I'm going to move my right hand, my shoulder that's on the wall. So this one is the one that's working. All right, because it's got like this resistance that's trying to drag it, so it's got to push out like I would on a push-up, so it encourages my serratus anterior to be activated, and I can just go into different angles and move around the wall. So I can go up as I've done the first few times, or I could go down or across. So in this case my right arm's got to work quite hard. Alright, so I've got to have this protraction as such, which generates that serratus anterior, which is so important for the health of the shoulder. Alright, so quite a clever drill. It's a lot harder than it looks, this one. But again, it's the band is actually feeding the mistake, and your body's got to overcome it with the necessary correction, or you just can't complete the movement correctly. Alright, so that's another clever one you can use that helps you to overcome stability problems in the shoulder. Alright, so next one we look at, this one takes a bit of setting up, so I'm just going to fast forward it for you. But I'm trying to show you how all of these I've done by myself, right? I've no one handing me anything. Now this time I'm going to do a chest press, alright? So I'm just going to play it from here. So I need a Swiss ball, and I need the band in both hands wrapped around a pole. Alright, so you can see how I've used this same band that I've used earlier, and you can see how I've got to get really close to the machine here. I've got the band in both hands there. Now I'm going to grab the dumbbells on the floor. I'm sitting on the ball, and I've got the band already in my hands before I grab the dumbbells. Alright, this is how you do this by yourself. Alright, otherwise it's easier with a partner who can you can get the dumbbells in the air and they can put the band on you. But this is if you don't have a partner, this is how you do it. Now what this is doing here is this band is pulling me backwards, alright? So this is activating subscapularis, which is another part of the rotator cuff that's very often very much inhibited within pushing movements, and provides the internal rotation of the rotator cuff as such. Alright, so I've just got this band, and you can see here when it comes down, we're at the hardest point here. This is the sticking point. This is where I'm really vulnerable to shoulder problems. The band is pulling me backwards. So my rotator cuff are trying to provide the internal rotation to avoid the dumbbells flying back over my head. And that's what helps to center the ball in the socket a little bit more effectively. All right, so quite a clever way to generate, very, very much like what we saw before with the overhead pushing thing, same sort of thing. All right, so just this is a horizontal pushing, not vertical pushing, and this is how you can really help someone rediscover their correct form within the pushing movement. All right, so quite a simple way. Just takes a bit of setting up to get it right. All right, so you just go back and rewind that video to see how I did it if you're not sure. All right, but these are all really excellent techniques you can use for the shoulder, and there's a stack of them that I've used for the knee and the VMO and the foot, and even some mobility things as well. So I might follow this video up with the lower body component of all of those, so you can see how they tie in together with this more shoulder scapular function. All right. So I hope you enjoy that video, and we'll see you on the next one.